Hello guys, let's learn today about one of the important function of the limbic system, that is nothing but controlling your feeding behavior. So in the zones of your hypothalamus, we have already seen one of the important zone was your tuberal zone, which was consisting your arcuate nucleus and ventromedial nucleus. Let's see how it actually is associated in controlling your feeding behavior. So now this arcuate nucleus has connection with your ventromedial nucleus and lateral hypothalamic nucleus. So when your arcuate nucleus releases alpha melanocyte stimulating hormone or cocaine amphetamine regulating trypsin, it basically stimulates your ventromedial nucleus to releases CRH. CRH, which is nothing but corticotropin releasing hormone, and this is basically responsible for the feeling of satiety. When you talk about the actually arcuate nucleus releases neuropeptide Y or else agouti regulating peptide, it stimulates your lateral hypothalamic nucleus to actually releases the orexin, and this orexin is responsible for the feeling of the hunger. So if you see, when your body is actually full enough, fat storage is good, it actually stimulates your adipocytes to releases a leptin. And when it comes to the glucose levels, when the glucose levels are sufficient enough, it stimulates your beta cells of your pancreas to actually releases your insulin. And when the GI muscles are stretched enough, the vagus nerve, which is the transcranial nerve, stimulates this all three. So this all three will be actually stimulating your satiety center as well as hunger center according to the fullness level of the body. So when you are, as I said, when you are full enough, this basically leptin, insulin and cranial nerve 10 will be stimulating your satiety center to give you the feeling of the fullness and to prevent the intake of more food. Whereas when you talk about the hunger center, it will be inhibiting our hunger center and preventing the intake of more food. When you talk about fasting, releases an hormone called as a ghrelin, and this ghrelin wants the individual to get the food more in because the individual is fasting. So it will be stimulating your hunger center or your lateral hypothalamic nucleus to release orexin and to actually induce hunger, whereas it will be inhibiting your ventromedial nucleus to actually give you the feeling of the fullness. So individual will be having the more food and the body will be getting the adequate amount of the nutrients. Thank you. Follow for more.